Today we meet a healthcare professional whose recent achievements reflect dedication, leadership, and the growing impact of physiotherapy in modern medicine. Let's all welcome our guest and new guest, and good morning Kuwait, Dr. Bashayer Alhay, specialist physiotherapist in musculoskeletal disorder or orthopedics and sport injuries. It's really a pleasure to have you, and good morning Kuwait, doctor.
Good morning, thank you for having me.
Dr. Bashayer, definitely, when we say sports injuries, definitely, everybody will pay attention for that.
Yes.
Most of the, guys in Kuwait, especially the sport, who's playing still football or, practicing any other working out or, definitely everybody pays attention. And, we have a lot of problems with knees and joints. That's the thing, unfortunately. And I know why, but we have to go through this. So to begin, you have recently received important recognition and awards. Could you tell us about this achievement and what they represent for you professionally?
I was honored, to be honest, completing my MSc degree and PhD in Brighton University in the UK. I was there for 10 years, away from home and family. So it was like a challenge. And also I received an award from 2 months ago from Porsche Award for awards here that represent women in business and entrepreneur. And they select only 10 finalists, and I was one of them.
Wow.
They select the best in their fields, like medical fields, business fields, fashion industry, cooking, everything in every field. So I was one of the best in the medical field.
So this is like the posh one.
Yeah. These achievements actually represent to me years of dedication and continuous learning, plus the passion professionally in research-based practice and advanced knowledge.
Nice. So this is really, that shows, how committed you are, dedicated to your profession.
Yeah, strong commitment to my field, actually.
So being recognized among leading women in your field is a significant milestone. What does the recognition mean to you on a personal level?
On a personal level, it means everything. It means the world to me, actually. It's like professionally, it's my passion, and passion in following my dreams and being the best in the physical therapy field, plus in research-based practice and advanced knowledge.
Amazing. So how, in your opinion, how do scientific and professional awards contribute to the development of the healthcare sector in Kuwait?
To be honest, in my opinion, it has a strong relationship. And in developing healthcare sectors in Kuwait by making everything with our patient with research-based practice. So we can provide the best method, valid and reliable to our patients. So that will help to develop healthcare practice in Kuwait. Also, it positions Kuwait as a country that values scientific achievement or advancements. So all of that help together to develop the healthcare sectors in Kuwait.
So Dr. Bashayer, does it motivate you, and how it motivates you to basically continue improving your work and expanding your impact?
Reading a lot, studying a lot, participating and registering in every workshops, conference that related to my field, the neuromusculoskeletal disorders and sport injuries, plus ergonomic. That will help me for continuous learning, updating my skills and knowledge in order to provide the best field to my patients.
This is amazing, because honestly I was going to ask you, out of the paper and questions about how do you, definitely there is always development, always, things are taking place, especially with nowadays advanced and cutting edge technologies. I mean, how do you know what's the latest in this kind of injury, knee injury, ligament, ACL, stuff like that, torn muscles, and these latest developments, how do you know about them? Usually?
It's just basically by registering in every workshops, conferences, because you will know the most updated in your field, like in UK, the state, even in Dubai, Saudi Arabia, Qatar. So you're gonna know everything related to your profession. And we have physical therapy association that help us to know the most reliable and valid conferences in Kuwait or outside Kuwait, workshops in Kuwait or outside Kuwait. So we are all in that field.
Because frankly saying, you know, when I have a torn muscle, for example, usually these devices still there in the club, you know. You know, the ultra differential
yeah,
sound.
okay, the electrotherapy.
Electrotherapy,
Yeah.
and you know, laser over there. Still, you know, they crack these voltage, you know, and basically circulates. Maybe this is for releasing. I mean, taking away the pain. Am I correct?
Yeah, the combined electrotherapy nowadays is much effective than before. The most recent and updated machines are now reliable and valid in order to diagnose patient, and you can choose from the body diagram the site of injury, either shoulder, knee, hip, ankle, anywhere in the body, the spine, and then you're going to choose the diagnosis. Let's say in the shoulder, frozen shoulder. What do you want from frozen shoulder? Do you want like to reduce pain, increase muscle strength, reduce spasticity,
so
improve circulation, or to reduce the inflammation in the nerve? So it's just like within the AI trend, you know?
That's amazing, because, you know, I've been, you know, for example, in sports injuries or field injuries, you know, torn muscles is something.
Yes, very major.
Yeah. We go to the sonar, you know, to
the ultrasound,
the ultrasound, okay, and then after that, you know, we start, you know, doing our journey of treatment, based on how big is the torn muscle.
Right.
So this didn't change yet. It's the same, correct?
It got updated. Usually, when patients come in, we're going to know the what type of injury and how that injury occurred. Is it an athlete due to sport injuries, or just going regularly to the gym?
Yeah, just a regular person.
Yeah, like a regular person. And then how that occurs, is that because of like wrong technique, or you are just like moving lots of weights that your body and muscle cannot handle? And then we're going to assess them. During the assessment, from head to toe, then we're going to know the diagnosis. We're going to read the x-rays, lab tests, everything related. And then we're going to have our specialized treatment plan for each patient.
So let's move a little bit further. And what are the most common condition or health issues you see patients struggling with today?
How to take care of their posture.
Oh, posture.
While sitting.
Really?
Yes, or standing. Usually 50% of the population know that we are sitting in a wrong posture.
Yeah, not 90-degree angle.
And 50% they don't know. Usually my patient, when they come to the clinic, they said, I'm having back pain. By taking history, I know that they have wrong posture because I can see deviation of the spine, like the scoliosis, either to the right or to the left. Or kyphotic posture, when there is rounded shoulder and a hump and the back of the neck.
Hunch.
Or or like lordosis, which is like hyperextension of the spine. Like usually patient, when in standing or sitting, you can see them like that. So I can see like my fist can go inside the spine.
Yeah, exactly.
Like there's a severe hole in their spine, the back of the spine. And
I mean, isn't that natural? No.
No, it's not natural. No.
So it has to be what, straight?
No
bending.
Not that straight, because usually the shape of the spine is a little bit deviated, like it has a shape. But usually it is like too straight. This is lordosis. This is not okay.
Okay.
Which create lots of muscle tension, muscle fatigue in the back of the neck and back muscles. And so when we know the diagnosis and everything, and with the assessment, I told them, okay, the problem that because you were sitting in a wrong posture for a long time, so in the long run, you will have like low back pain or deep muscle spasm. They said, how I'm going to sit? I said, you need to sit correctly. When they show me, they said, okay, I'm sitting now, okay. I said, this is not okay. This is wrong. You are sitting in your hip. So how am I going to sit? I said, okay, this is the wrong sitting posture. They know, but they neglect.
Okay.
They care once they have red flags.
Okay.
Like pain, spasm, unable to sleep, like pain radiated from the hip to the lower leg, which is sciatica pain. Then they take care.
Yeah, definitely. These, you know, they become really, you know, a lot of people nowadays with the social media and exactly with the likes of you, Dr. Bashayer, you know, taking a lot of advices of how we sit, how we sleep, definitely
Yes.
how when we stand, you know, the way we walk, definitely these, you know, affect us. So you specialized in musculoskeletal and movement related conditions. Why have these issues become more common in modern lifestyle?
Because nowadays we are more technology dependent.
Okay.
We are using our phones,
Indeed.
iPads,
Indeed.
like kids with games machines like PlayStation, Nintendo, and all of that. So that will help to create lots of injuries in the long run if we are sitting incorrectly. Also the obesity.
Obesity, yeah.
Yes,
definitely.
and sedentary lifestyle. Like some people doesn't like to exercise.
Okay.
Yeah.
Yeah, unfortunately, that's true.
Yeah. Aging population, when balance is reduced, and the walking pattern is not that okay. It's not normal. So all of that, all of these modern combined to lead and in need for neuromuscular disorders and sport injuries plus ergonomic.
So definitely, many people delay seeking physiotherapy treatment. What are the most common misconceptions you encounter among patients?
Usually they think the physiotherapy sessions will cause pain.
Really?
Yes, they think that, but actually this is 100% wrong. Or they think that in order to take a physiotherapy, the result will show for a very long time, like later. I need like 12 sessions or 20 sessions until I see the result. It depends on symptoms and the diagnosis itself.
On the person, yeah. Also.
Maybe within 5 sessions,
maybe
your injury is done.
Exactly.
So, and some of them, they think that electrotherapy, physiotherapy is only machines, and they don't see any result with the machines.
Yeah. Some people, they think it's a massage.
Yes, I'm going to say that. Yeah, they think it's a massage, so let's go to a spa instead of physiotherapy. Although we don't have massage.
That's true.
We do hands-on, but it is like mobilization, manipulation, technique, like manual therapy, but not massage.
You know, one of my teammates back in the days when we were playing officially for the club here and the league, he had an injury. He went to Europe, you know, to a physiotherapist well known in Italy. And one of the, you know, it was his muscles had a problem. I don't know what kind of problem, but it's mostly torn muscles, and they have this such thing called capsule.
Yeah.
Yeah. Anyway, he treated this, but then he learned from other Brazilian player, that torn muscle needs massage. Believe it or not, because you know when the muscle, he explained for me, when the muscle's torn, they have the tendency to kind of wrinkle. So they try to, you know, straighten the muscle at the beginning, and then I guess they, you know, they do the other.
But actually this is wrong.
Yeah, I mean, that's back then.
Yeah, that will help the muscle to be more torn and ruptured.
Okay. But it's not massaging nowadays.
No.
The
like
latest.
When you're fatigued or stressed, just go have a spa session, then just to relax. But when you have an injury, you need like to go to the a place, like authentic place to treat your injury, like a physiotherapy orthopedic department.
So massaging is not good. Don't do massage when you have a torn muscle.
Yes,
yeah.
definitely.
Yeah. Anyway, Dr. Bashayer, unfortunately we are out of time. So if you have any message you want to convey to the viewers, it's your time.
I just want to say thank you for hosting me.
Thank you.
Plus, set your goals and believe in your abilities, and always invest in your education. Then we can create the best healthcare system to our patients.
Inshallah, definitely. That was Dr. Bashayer Alhay, specialist physiotherapist in neuromusculoskeletal disorder, orthopedics, and sport injuries. We'll definitely thank you very much.
You're welcome.
And we'll go for a break. Dear viewers, please stay tuned and don't go away. We'll be back.